So the first question I wanted to explore with you has to do with the setup of the device, because people have a lot of resistance to the goop, right? The conductive paste, and teenagers don't like to wash their hair, and so you get the whole resistance that's there potentially. And so the first question is, why do you use conductive paste at all? And then the second question is, there are now headband devices that use dry sensors. So would you consider switching to a dry sensor headband device instead of the goop?
Let me start with the second one first, because then getting to that first question will make more sense. I not only consider moving to dry sensor technology, I've been involved more or less in every single dry technology that's come down the pike. There were ones that were available even back in the 80s. So the problem with those is that they simply don't give us the kind of signal integrity that we need. And a big part of the reason for that is because it has to use a very different sensing technology called active sensors of some kind. There are various different kinds, and I won't go into all of those, but it's very different from the passive sensors, which are what occur when you have the goop, when you have conductive paste involved in some fashion. So what the various companies do around these dry sensor technologies is they chop off some of the most important parts of the frequency response, in my experience. And that's notably the low end and the high end. We look from 0.001 thousandth of a hertz, in other words, all the way up to 64. Most of the dry sensor technologies cut off the low end response at about 4 hertz. And that really removes some of the most important aspects of the signal to consider, because it's those low, slow, very powerful points of activity that can influence the rest of the central nervous system quite profoundly. As a counterpoint to that, the seizure activity is essentially 3 hertz. So you're precluding accessing any of that slow activity that can totally co-opt the entire CNS if you're using the dry sensor technologies. They get away with it because they look at things like alpha band or beta band, and they try to simply ignore those low, slow frequencies, which is just not the way that we work. It just isn't at all. So as opposed to the active sensor technology of the dry headbands or any of those kinds of things, we use the passive sensor technologies that rely on conductive paste. And the reason for that is the scalp activity that we're picking up electrically is in microvolts. And it's usually down around 5 microvolts per particular target, somewhere in that sort of range. In other words, it's very, very small amounts of current. But the activity we monitor occurs in a context where there's line current. Now, in the US and in most of North America, that's 110 volts. If you go to Europe, it's 220 volts. Well, you look at 100 or 200-ish volts compared to 5 microvolts. What we're trying to pick up is akin to trying to hear somebody in a crowded auditorium whispering on the far side while a hurricane's going on outside.
So
you need to have very sensitive and receptive equipment. That's the bottom line. And the dry sensors just cannot provide that. It's that simple.
Let's go on to the topic of the data that's being collected from the sensors. And for some reason, people get very spooked by the phenomena of having the sensors out and the program running, so that the sensors are picking up, as you said, before, the voltage that's in the environment, and they start to hear that there is the interruptions in the music. And the conclusion people reach is, oh, well, the system's a sham because it's still giving feedback, even though clearly there's no, scalp connected to those sensors. So can you speak to a little bit about why it is that the system is still giving those auditory cues, even though it's not hooked up?
Well, one of the things to remember is that the system doesn't start up automatically. You have to start the computer. You have to launch the program. You have to push the control. You have to double tap on the client name to start a session. That's the human responsibility. But there's one other big responsibility, and that's to put sensors on the head and use the right amount of goop and in the right locations and that sort of thing. The program says, okay, you're starting me up. That means you've actually hooked up a human being, because that's the part you can tell as the operator. The system says, I'm here to do the best I can with the data that you allow me to have access to. So if you happen to try to run a session just outside of the CT device while somebody's getting a CT or an MRI with an MRI device, it's going to do the best it can to interpret it in the midst of that phenomenal magnetic and electric field generated by those devices, right? Which means it's going to be a little bit different than if you're just sitting at home quietly and you have the sensors on and you run a session. Question of how well designed a system is to provide training, as opposed to being assumed to environmentally exist only in a pristine research lab, in which case, nobody starts up the system with it not connected, because it would still record data. There's no system out there that won't. I mean, it's just...
So maybe that's something to talk a little bit about, because I don't think people appreciate that there is electrical activity, electrical communication in any environment. And you gave the extreme example, right, of being by an MRI machine, right, which is going to have a very loud communication. So what you're saying is that regardless of whether or not they are the microcurrent data from the human scalp, it might be the microwave in the other room, it might be, the 60 hertz line noise of the environment.
And it depends on proximity to those significantly louder, if you will, volume sources.
Maybe the next question could be about changes that have happened. Specifically, there used to be the option to show people a little graph that showed the pre and post of that session, and some, and correct me if I'm misstating this, but some efficiency change between the beginning and the end of the session. And you got rid of that. When was that? Like 5-6 years ago. And now the encouragement is for people to solely use, obviously, the most important thing, which is noticing changes in your experience directly, but secondarily using self-reporting checklists. And we have created a numerical value for our checklists so that people, fill them out at the beginning, after 10 sessions. But can you speak to why you went away from the kind of quote unquote more objective data, right, of the graph to these more subjective measures, such as how they feel or using a checklist?
Well, it's actually a fairly complex and rich topic, and so I'm going to try to hit the highlights of it.
Great.
The history of the specific measure that you're talking about came about in the context during development of NeuroCare Pro, actually. So this was quite a while ago. And Sue had a very particular client who was very fragile, immune system involved, seizure disorder, just a variety of things going on for this person. And she wanted to know if I could come up with something to predict the likelihood that, absent huge environmental stressors or events like getting fired or things like that, was it reasonable to expect that this person was going to be reasonably resilient till the next time they came in? So I took that person's particular data and was able to subject it to a certain form of stability analysis, very high level math, and said, this is not definitive, but it's at least somewhat indicative for this person. Now, the problem was people took that measure and did all kinds of interesting things with it that just were not supported in the data and had never been prototyped for. And then we also changed amplifiers, which changed the data stream. And given all the misinterpretations that were getting put out there, and this was a straightforward, simple kind of measure, it was very clear to me that a large part of the problem was people were over-interpreting and didn't understand what they were looking at. So back when we had spectrograms showing, people came up with some really amazing interpretations, and they had nothing to do with reality. I mean, they just didn't. So a large part of the reason that all of that stuff was there in the early development days was the more information I had access to, the more I could make sure that the various tweaks and tunings and extensions and modifications I was making to the overall targeting, that it was useful as opposed to not being useful. By the time we implemented AutoNav, the system was inherently fail-safe and fault-tolerant, and far more so than anybody, including Sue, which was fascinating. When you have enough data, you can model what an expert does. And you can make sure that that model, if you have complex enough systems, complete enough systems, that it can actually take into account times where that expert missed the mark a little bit. So it becomes its own sort of learning engine. It's a quick way of talking about artificial intelligence, or one of the main things about artificial intelligence. It takes years for an expert to develop that kind of sensitivity. And no matter how good they are always going to be slower and less comprehensive than the computer is. Because the computer, that's what it does. It calculates things. So unless you're really good with a slide ruler and a bell, the computer program is always going to beat you in terms of providing feedback in real time, because it's operating faster than your unconscious can operate, even, let alone your conscious. So by the time you detect in your head and say, oh, I should modify this, AutoNav has already done it way before you and been monitoring to make sure that that change, along with 3 others that it does, actually are furthering the process. It became redundant at best. And actually, we found that people use them to not good purposes. There was a lot of mythology that went out there that we had to unlearn people from, if I can put it that way. That was a big part, is to help people unlearn these things that they had developed or been taught by others who had developed them, even though they just were based on nothing.
So the just to make sure I'm following, so the previous more of kind of objective data graphing capabilities were part of the helping you in completing the design of the system.
Yes.
And people who were trainers were presenting that data to clients in a way that misrepresented what the data was actually saying.
Exactly.
And so not helpful. And then the AutoNav technology, which is the perfection of the full automation of the system. So like you were saying, someone doesn't have to be tweaking protocols to get the best potential outcomes.
Yes, exactly. It's an interesting process to look at because for a long time, one of the international conferences organized around neurofeedback was very heavily committed to QEEG technology. And what they did every year was have a panel where they would bring in 5 or 6, depending on who was available, of the experts in QEG, and they would give them blind data. And it was derived from real life case and all of that, but no identification, no nothing except, male 54 or female 28 or, whatever it was. And they asked these 5 or 6 experts to interpret this and suggest protocol. No 2 ever agreed. And we're not talking about subtle differences here. We're talking about profound differences in protocol, even from trainers, even from those experts who use the same systems. So after, I think it's 5 years of doing that, they discontinued that panel. Now, this despite believing that QEG is the way to go, even though it's based on averages. And it's a whole other thing we can talk about at another time, is how come that stuff doesn't work. But one of the really dramatic presentations that one of our people made at one of these conferences was they worked with someone who had been followed for many years with QEG driven neurofeedback, and never did get the results that they wanted. But they then landed with one of our people, and I've forgotten now exactly. I think it was within 10 sessions, maybe 20, something like that. Notice profound differences. And areas that supposedly, frequency areas of the brain that supposedly we weren't even targeting, that the prior approaches had specifically tried to target, renormalize themselves just using our standard approach, which kind of indicates that the beliefs around this quote objective data are just not objective. They really aren't. It's a belief. It's not actual established reality. And if you look at the mathematics of all of that, they're very clear reasons. The central nervous system is a nonlinear dynamical system, which means you really cannot grasp it linearly. You can do that for 60% of the time, maybe, depending on what it is. But beyond that, no, you really can't. And the belief that you can is the thing that has never been objectively verified.
And so using checklists, the NeurOptimal checklist or the template has a whole wide range of potential issues, or we could call them, some of them we could call symptoms. And so why have such a wide ranging checklist?
Because people come for all kinds of reasons. Why close the doors? You know, the phrase that I've always used is we're diagnostically agnostic. Or another way I used to say that was, I don't care what walks in the door. What does it mean that it's not relevant? It means it does not further the operation of what we're trying to achieve. It's just not useful.
And so I noticed that one of the checklists that you designed has people rate whatever the symptom is or concern is on intensity, duration, and frequency. Can you say something about why are those the three measures that you're looking at?
Well, and shift as well. One of the things that you find as people transform using NeurOptimal and other ways, this is general transformational principles, the way they interpret the world shifts as well. So if you find yourself in a chronic pain dynamic, if you, because of physical injury or for whatever reason, your whole world reorients in terms of pain level. Where's the pain? How intense is it? How long is it lasting now? How is it limiting me? How much can I do? How much energy do I have to do things I have to do? Oh, I better not try to do this because I've got to do that later. And if this tires me out, I can't do that, but I have to do that. That's the way life starts to organize. One of the things that occurs as that chronic pain focus starts to transform, however that occurs, it occurs because some operation is done or series of operations that restores a greater degree of function, or whatever it is, whatever rehab is done, whatever the program, the approach, that organization of the world starts to change. And it's no longer, it gets to a point where the person even notices, oh, I'm having that pain now, as opposed to how bad is it because it's always there. That's a profound phenomenological difference. After she was continuing to do neurofeedback using what was then the 5-phase model, she said, you know, I noticed one day I didn't even have any medications with me. It wasn't that I stopped taking them. I stopped even carrying them because the idea that I would need them didn't show up in my worldview.
Right, right.
That's the kind of difference that comes from looking at shifts, frequency of event, intensity of event, and duration of event, as opposed to saying, yes, I had a migraine. Okay, but how long did it last? Was this the first one you had this week? Because remember, you used to have them every other day or 2 days in a row. How intense was it? Is it less intense than the last one you had or more intense? Because change is change. We tend to think of it linearly and we say, well, it was more intense, but yes, it was only one. And gosh, you know, it only lasted 45 minutes. They usually are 5 hours.
So
All
it's
right, well, is that better
capturing.
or not? Yeah, it's capturing that whole phenomenon rather than just, yes, I had one. No, I didn't.
Right. And that's, I mean, that's one of the things that we notice continuously with people training is that they forget very significant things that were
Mm-hmm.
present when they first started training. And it's only through looking at their first checklist and seeing, like, 10 being the worst, all those 10, 10, 10, 10, 10s,
10 tens,
right? And then they go, wow, I totally forgot. And so that, I think, is another interesting feature of how the brain renormalizes, and as you said before, decreases pain, is through forgetting the old pain. And so there can be this sort of new experience.
Well, this is a backdoor entry into a fundamental part of what Carl Pribram talked about in the holodynamic model of consciousness. It's memory, perception, and consciousness, right? It's not just one as though they're separate. So the horizon of possibility that you see in front of you is partly in terms of the history of the world that you lived through. And it can't not be that way. To say it another way, as your horizon of possibilities shift, you look back on the past with new eyes. There was a person who was, rather prominent in our community, and used to always say, it's like therapy through the rear view mirror.
Yes.
Because you have to look backwards to see how just totally different things are now.
Mm-hmm.
And in some ways, that's very true. You see that profoundly in the difference between folks as they pass through their immune disorder problems, the attendant issues, the lack of concentration, for instance, the difficulty sleeping or getting restful sleep, various things. And as that changes, instead of counting how many successful nights they have, they'll say, oh, I had a night that was a little bit less restful last night. So, gosh, well, I don't know. It's like, 3-4 months. I can't think of any other one. But that's how things work. That's not, that's good. Let's put it simply. That's the good thing. It's not so much that we're forgetting it. It's that we're not continually reminding ourselves of that.
Way to talk a little bit about extrinsic constraints, or the variables that
Sure.
can impact the changes that people see from their training. So because the system is not targeting a particular symptom and actively trying to change it to improve that symptom, right? Whether it's anxiety or lack of focus or whatever, right? But as you say, increasing the flexibility and the resiliency of the central nervous system. So really the question is, well, what gets in the way of the brain being able to be flexible and resilient?
Well, see, and I would say that it's important to shift the words from increase resilience and flexibility to restore access to the intrinsic flexibility and resilience. It used to drive me crazy back in the early days when the best that was understood at that point was about beta up, theta down. We've talked about that for certain forms of attentional drift, and people would say, well, I'm going to give them some beta. No, you're not. You're just informing the central nervous system when it's producing it itself. You don't give them, okay, here's a quart of beta, we're going to pour it in your ear, and yet the language that was getting adopted was this other thing, like, I'm giving this to you. What can get in the way? Anything that isn't just the training is what can get in the way. Anything. So it can be what you're eating. It can be how you're sleeping so that you don't really get enough sleep. It can be how much exercise you get, either too much or too little, or the not best kind for you at that time. It can be other medications that you're taking for whatever reason. You know, I I have atrial fib right now because I had a tumor in my left atrium that had to be removed surgically 30 plus years ago and left scars. And that's just the way it is. So I get to take an anticoagulant medication, which means I get frequent nosebleeds. Well, nosebleeds are a lot better than having a stroke. So I'll take that. That's an extrinsic constraint, you know. So like keep tissue nearby or whatever, and it's like, whoops, yes, here we are. You know, it's a factor. But if I'm looking at some idealized outcome that I want, then it's a different way of approaching it. You know, it's like, okay, the whole goal here is to decrease the likelihood of stroke. Everything else just becomes a factor that goes along with it. So, what are extrinsic constraints? Not getting enough sleep, getting too much sleep, not exercising enough, exercising too much, not eating things that really support you, eating things that don't support you, other medications. Many times it's beliefs.
Mhm.
It's beliefs. And beliefs are some of the most foundational stuff because they are so formative that they're invisible.
See that a lot with people who are anxious. If they have a belief that their anxiety is an asset to them and
Yes.
helps them be productive, it helps them be, attentive. What tends to
Right.
happen for those people is that usually somewhere between like session 6 and 8 of NeurOptimal, that they start to either come up with reasons why they can't do the training, or they become
Right.
fearful because they're starting to really, feel calmer, right? Because,
Right.
anxious uses a lot of energy needlessly. And then they re-arouse that anxious feeling by saying, I need it, right? This
Right.
other feeling is depression. I don't want depression. Right. And so
Right.
they
Right.
give it a negative label, and then they tend to stop training if that belief is firmly held, which,
Yeah.
as they should, if that's what they believe.
Well, and beliefs are very interesting because they are almost always negative,
Mhm.
and even ones that are framed sort of positively or seem to be are actually hiding the negative belief underneath. So, what are the extrinsic constraints? Almost always they come down to beliefs, one way or another.
Mhm.
Almost always. But they frequently have a gateway to them through these behavioral cues of some sort. Oh no, I always have to have the coffee. I drink 6, 8 cups a day. How come I'm so anxious? Um, well, we'll try a little experiment. Let's get information. Let's see, you know, because nobody starts drinking 6 cups when they're a month old. This was a learned behavior somewhere along the way, right?
But what is it about the technology that, say, for example, makes it appropriate to, do sessions with an infant? Let's say an infant.
Because it's not treatment. It's not treatment. It's just information. It's sort of like showing a child the mirror on the wall. Like what's too young to show them the mirror on the wall? Well, they just won't recognize it. They'll just ignore it if they don't have the visual acuity. But there's no harm in that. It's just information. The questions about you know, like how safe is it, and always intrigued me because the foundation of, especially if you go back to like the 5 phase model, the earliest thing I wrote, the foundation of it is keeping every session as comfortable and safe as possible. So, how much is too much? Well, there isn't too much in the sense of a negative reaction. It's like, how much alcohol is too much? Well, some folks would say any at all, and others would say differently. What is it for each individual? Well, that's something that everybody has to determine for themselves. What are the contexts and all of that? And that's not a for or against alcohol use. It's a statement. Yes, there are certain guidelines, and what's becoming clear is more than a glass of wine a day or whatever seems to have some health implications. So it's something to consider. It's just information. But this is only information. It's like, can you overdose looking in the mirror? No, you just get tired after a while of doing that. It's not like, oh no, I've already looked twice today. I can't look anymore. Something terrible will happen. Well, that's an interesting belief too, you know? So, what happens is sometimes people have what in another context would be called gaining mind. Like if a little is good, a lot is much better. So, okay, I'll do 5 sessions a day. Well, pretty soon the brain and the body just goes, no, we need to do something else. This is just, ugh, I'm tired of this. And basically the brain will ignore after it becomes too much. It just ignores it. It deletes it. It deletes the information. So how much is enough? Well, everybody has to decide that too. We just recently did a month-long charity push where everyone on the Zengar team, the company Zengar team, was tasked with the idea of doing a session a day. And for each session done on each day, there was a certain amount of money that was going to be paid to this charity that was chosen, a local charity. And no, if you did 2 sessions a day, it was just one. You couldn't, you could not. Well, I did 10 yesterday. Does that count? No, it doesn't count. And that's really because there isn't a clear benefit to doing more than the regular 33-minute session. Yes, we have the extended. Yes, you can do different lengths and all of that. But that's really because people just got used to that. And, no, I love to do the extended 44-minute session. It's like, okay, well, do it. But you just don't believe that it's somehow better because it's not. It's not better. It's not worse.
So that leads us into kind of the future of NeurOptimal. Do you see a 4.0 design? And then maybe the next question is, where do you see NeurOptimal or even neurofeedback as a field going, 20, 30 years from now? Do you have a vision for what's possible?
Oh gosh, it's so interesting because there are, of course, many possibilities of things that can be done. It's important to bear in mind that for me, the criteria really involve not so much the question, can it be done, but is it useful to do it? So a lot of people are very involved in the quest for VR and AR kinds of events, whether in the neurofeedback field or other fields, just gaming and all of that. And yeah, that technology is definitely going to continue to evolve. Now, is that going to be important for NeurOptimal? No, I really don't think it will. And the reason I'm thinking that is because we found over, 30 years or whatever that I've been involved in neurofeedback that the music you use doesn't matter. The visual you use doesn't matter. Those are distractions at worst. You get so involved in the movie that you don't even hear the interrupts maybe. Now, that doesn't happen the way the system is designed, but in an AR, VR kind of world, who knows, maybe it could. On the horizon, what's on the horizon is further developments in the core technologies, which will make it increasingly a smaller footprint. Back in the day, we needed to have, a desktop computer with its own monitor and then a whole separate monitor. And it's a lot of fun going to some of the conferences and transporting all that stuff, Now it's not that way, right? It's become, much more compact. That trend will continue. Will we get to the place where there'll be some form of not needing the goop sensor technology that is sufficient for our purposes? Probably. When is that going to happen? When it happens, that's I just don't predict any timeline. It's hard to imagine it becoming much simpler than it is, but there are parts that I think will be slipping away because they're legacy of the earlier versions. And things like, saving your sessions, for instance. Well, they're not really necessary anymore. They just aren't. Playing them back doesn't move the goalposts at all. That doesn't change anything. Educating clients by playing back a session or showing graphs or whatever points you in the wrong directions. That's not their life. People come for sessions because of what's going on in their life. They don't come in and say, I don't have enough alpha when I'm attending to tasks or whatever. I'm just making that one up. They don't say that unless someone else has told them. And then it's a belief for them. It's like, well, did you try that approach? Yes. Well, how come you're here then? Well, it didn't work. Oh, then why are you holding on to that as the belief as to what's wrong or what can be changed or what needs to be changed? There's all the stories and the wisdom traditions, about the real prison is the one in your mind. It's the beliefs, right? Open the door to the cage and you may still just walk back and forth because it's familiar. Can you really step out into that world and be with the freedom that really young children just thrive on? They just have fun. That's how life can and really should be. So the whole thing is really, it's a quest for the freedom of liberation.
But it sounds
That's
like,
a whole other story.
yes, it sounds like from in the near future, though, there aren't big changes on the horizon for NeurOptimal.
No, I really don't see it. And now, is that because I'm just not looking? No, I'm always looking to see how things can change. What can we do so that it's even safer, even easier, even, whatever. I mean, pick up your comparison point. But when you start to look at things, people frequently will ask, well, I really think that, 80 hertz, or they'll have some magic number in their heads that'll be really important, and geez, if we could only train that. And frequently those are approaches that are oriented to training very specific states and a belief about what goes to those states. And it's like, I don't see the point. Because how do you know that state exists? Well, because humans have achieved it somehow. Well, how did they achieve it? Well, they meditated with a certain technique for a long time. Okay, maybe that's still the best way to do that if you want to do it. But why do you want to do that? What's the point? well, I just think it's cool. Okay, I'm more interested in transformation of suffering. I happen to think that's what's cool. Okay, all
All
right, well,
right.
good.
Well, thanks again, Val. I so appreciate your time and of course,
Yeah.
all of your efforts and, the product you've given us. It's, yeah. Anyway, thank you.